So for those of you who don't know me, I'm Angela Douglas. I am now president of BIVDA, but you may have known me previously as someone who ran genetic services for over 38 years. And then for the previous 5 years I've been Sue Hill's deputy and now retired, she thinks. I'm going to gallop through some of the first slides because we've heard quite a lot of this already. So for those of you who don't know BIVDA, we actually work around investment, influence, innovation, and inspiration. We are the trade association for the life sciences industry. We work very closely with our industry members. We advocate for them, and I'll say a lot more about that. So we have a vision to advance vital roles of diagnostics in shaping healthcare, and also using our voice so that we can really advocate and innovate and be collaborative so that diagnostic sector can sort of be a centre of advancing healthcare. We've heard a lot today about the importance of diagnostics, and I don't have to tell you, some of the importance of diagnostics. We've heard about how diagnostics is going to rule out the causes of ill health. It's going to be there potentially around health problems for prevention. It's going to help people manage diseases in their in their own homes, in their own conditions, and we're hopefully going to prevent ill health. And these are things that BIVDA want to sort of really get behind. We've also heard a little bit about the benefits of diagnostics, and again, I don't have to tell all of this audience about some of the benefits. And again, we've heard quite a lot about this, and some of those benefits, for us in BIVDA are around the whole manufacturing and export piece, and giving that global resilience to our industry members. So what's key for BIVDA is that we have actually been quite a contributor to both these plans. That hasn't always been the case. I mean, the 10-year plan, we've probably had 3 or 4 10-year plans in the last 20 years. But this is the first time that BIVDA, as an industry partner, has been asked to really help shape the 10-year plan. And we were also asked to contribute to the life sciences sector plan. And the good thing about doing that is that we were able to ensure that both the 10-year plan and the life science plan aligned itself. So this time we can really see the two coming together. This is what our chief exec said, and it's very similar to what Sue said earlier. The plans are bold, they're ambitious, they're outcome focused, and they have an emphasis on delivery and accountability and working with partners. And I'll re-emphasize that, working with partners, because right the way through both plans, that is really, really essential. And there are some strategic contributions that run through both plans, that diagnostics is going to be really important for delivering some of the goals. And some of those we've heard about today, but importantly, they're around the accelerating that early diagnosis and prevention. They're about supporting community-based digital care. They're about delivering the NHS reform through innovation adoption, embedding world-class R&D in clinical trials, and harnessing health data for innovation. We've heard lots of good examples of all of that. And the function of BIVDA is to get behind some of that, and from an industry's perspective, to make sure that diagnostics are pivotal to all of that, as well as new job creation, regulatory reform, and inward investment across the sector. Now, the UK government has an ambition to make the UK one of the biggest providers of the life science industry. Obviously, China and America will always be way out there because of the size and the amount of money that they invest in industry. But nevertheless, the UK government still sees the UK as a major contributor of diagnostics and the life science industry alongside our other European partners. There are also some real economic impacts that have been written through the 10-year plan. And some of these, especially around the IVD contributions, are around boosting the UK life science growth. Now, life science in this country contributes to about £100 billion to the UK. It's an awful lot of money and growing. And it employs around 300,000 people. So it's an awful lot of people that are employed in the life science industry in this country. One of the impacts is around reducing NHS costs through prevention, and that's something that BIVDA can do. We can work with our industry partners to ensure that new diagnostics that are being produced, those diagnostics that they're working on, those new innovations, are always identifying a clinical need. There are some other economic impacts around, again, accelerating that innovation adoption, and we've spoken a little bit about that, around unlocking that value added. Now, we've heard a little bit about costs today, but one of the really big things that BIVDA wants to concentrate on is the value proposition. It's not about the cost per test. It really is about the value that it brings to a clinical pathway, to the patient, which is really key, because if anything else, the patients should be center to everything that we do. And it's about creating a high-skilled jobs regional growth. So where there are good industries working in collaboration with the NHS, we can really start to grow the region. And there are some emerging concerns as well. I mean, this is a really ambitious plan. Both are really ambitious plans. There's very little money involved. And one of the biggest questions that I'm being asked through the NHS and our industry partners is, where is the funding coming from? There's an awful lot of funding ambiguity. And if you talk to some of our GP colleagues, they will tell you that there are also some contract risks. You know, who is going to manage the contracts? What about workforce pressures? I was at the IBMS last week, and the one thing that we did hear loud and clear is that there are some real severe workforce pressures amongst our scientific workforce and our nursing workforce. So how's that going to be squared off if we're going to be moving diagnostics into the community? What about some of that oversight around accountability, about standardization, about calibration? How's that going to take place? And then there's this whole neighbourhood health model, and there's a load of uncertainty around that, and more so around who's going to be accountable. Is it going to be the ICBs? Is it going to be the forming trusts? And again, the uncertainty also means that funding doesn't flow as quickly as it should. There are uncertainties around the clinical safety and around accountability. And when we talk about digital and AI integration, and this has already been mentioned, there are some concerns around people who may not be able to access that level of digital. They just don't have the knowledge or the skills, and there's a risk that comes with that. And again, that's something that BIVDA can help with and advocate, working with our industry partners to make sure that anything digital that goes along diagnostics is as accessible as possible, taking into consideration the breadth of people who will be using things like that. And the emerging concerns that are in the life science sector plan, we've already, again, heard some of those, and some of our members are leaving the country because of this, especially around regulatory and compliance and complexity. UKCA MHRA regulation is really complex. It's not quite there yet. It's constantly being reformed. I've already mentioned some of the workforce and talent shortages. We also have some real supply chain vulnerabilities. And as we start to lose more and more industry to other countries, they move out of this country, that becomes more of a risk. And then we have this innovation versus cost pressure. And I said before, it's really not about the cost. It should be about the value. It should be about the value proposition, the value to the patient. But nevertheless, industries have to make ends meet. And we've seen so many of our SMEs go under, not being able to run their products, even though they've run really great pilots with NHS organisations and they've had their products embedded. Nevertheless, the company has gone bust. And those are things that we really need to work with. And this is one of the biggest concerns of our members. And, as I said before, the UK has this global positioning ambition in both papers. And again, this is something that the BIVDA really need to work very closely, not just with our industry partners, but across the sector. So there has to be contractual and structural change for these plans to work. You know, it's about transforming care models. We've talked about that, and care pathways, and that isn't easy, and especially under the current pressures. And unless contractual change is phased, supported, and co-designed across the whole health system, which can include industry, and we've heard some of that today, it can fail very quickly, and we've seen it fail drastically with some of our industry partners. So mandating alone isn't enough. We need to have transformation of culture, and we've already heard that mentioned today, and structure. And again, BIVDA members can support this working with industry. It has to be a norm. It can't just be the exception. And we've heard some really good examples of working with industry. And with all of this, alignment is key. So in BIVDA, we say alignment has to be across contracts, metrics, standards, incentives, and leadership. It can't be siloed. It has to be right the way across the system, because if it is fragmented reform, it simply won't deliver the plans. And at worst, it can make existing issues more entrenched. So what has BIVDA done lately? Well, we are the advocate for our industry partners. We advocate with government. We ensure that any policies or legislation that's going to come out of government is not going to put our industry partners in a difficult position. We work with our industry partners to ensure that they've got improved access to medical diagnostics for patients, that they can produce the sorts of diagnostics that bridge a gap, that are really needed, not just tweaking what they've got. And everything else that's written there. So what will we do to deliver the plan? So we've been working very closely with the MHRA. And earlier this year, one of the things that MHRA did was to start to consult on what the pricing would be for UKCA marking. And what became evident very quickly is that a lot of companies would have gone under if the pricing that they were anticipating rolling out was going to be rolled out. So we were able to advocate for our industry members to ensure that the pricing that came out for UKCA marking, similar to the CE marking, was going to be proportional to the size of the company and proportional to the product that was going to be released. And that was a real positive for our industry members. We're also currently advocating for harmonisation around global standards. So global standards are the standards to which our industry partners have to work to produce their products. And if they have to have a different standard in every different country, it makes it very difficult for industry to want to work in this country. So we're advocating for harmonisation across global standards. We also want to ensure that ISO standards align with UCAS standards, align with the UK MDR, align with quality management system updates, so that makes it not only less complicated for our industry partner, but also less complicated for services who are going to be using those diagnostics. We support our partners with roadmaps, with validation, with revalidation. We support them with supply chain reviews. We also support with training and education on emerging new technologies. We ensure digital infrastructure upgrades have cybersecurity built within them, and they are interoperable, because that's really important, we recognise, for the NHS. And we also ensure supply chain resilience. We work with our members to make sure that they are working within the practices of sustainability, and they're delivering on their environmental obligations. And to do this, we've set up a whole series of working groups. And our working groups are made up of our industry members. They're made up of NHS colleagues and other stakeholders, including Office of the Life Science, the NIHR, and other bodies who might want to be particularly involved in any given working party. And you can see the list of working parties that are currently up and running. And the working parties are responsible for working with government to make sure that any policy or legislation that's going to be produced is going to be good for the NHS as well as good for our industry partners. And in particular, the last one is a recent one that we have set up. And by focusing on the Innovation Working Party, this is probably the one that's going to be the mostly working on delivering the 10-year plan and the life science industry sector strategy. And this is where BIVDA will really have an impact on government and working with the NHS seniority at the moment in NHS England to ensure that the way forward and the way that the actions are going to come out to deliver the plan are going to be positive for our industry partners and therefore positive for the health system going forward. The plans are a fork in the road. They are bold and they are ambitious, and they do need money and investment. They need investment in not just infrastructure, IT and interoperability. They also need investment in personnel and workforce to deliver. There has to be a blueprint that underpins the plans so that we can have meaningful transformation. But both plans are a real opportunity, and we've heard about some of that today, but they can also be a risk if they're not delivered in the right way. So the question is no longer what is it that we need to do, because I think we've heard today what it is that we need to do. It's how do we do it well, with those delivering care working in alignment with other stakeholders. And we've heard some really good examples of that today. And that's the mindset shift that's required here. So it's a structural and a cultural shift that's going to be needed. And that's a mission that BIVDA is happy to support. And for those across the health system, the time to engage is now. We need to influence and shape. The time is to do that all is now, because that window of opportunity isn't going to stay open for long. I'm going to leave you with this last sentence here, because I've spent a lifetime working in the NHS. I spent 42 years working in the NHS, and I've only been in industry for the last 2 years. When I worked in the NHS, I thought the industry had it really easy. And since I've been working with industry, I recognise that industry have the same challenges we have in the NHS, and we will only make the most of the two plans if we worked together, because investing in diagnosis is an investment in better care, improved population health, and a stronger economy. And by supporting earlier intervention and more precise treatments, diagnostics reduce strain on service and improve outcomes. So with the right approach, focused on value, not cost, collaboration, and patient need, BIVDA can ensure diagnostics plays a more prominent role in a sustainable NHS. Thank you.
Thank you very, very much, Angela. That was fantastic. A really thoughtful, insightful view of where we are, and I think sets that all the optimism we've heard today, which this in no way diminishes, but absolutely sets that in context of the realities that we are all working in. We've got time probably for one or two quick questions. Yes.
Thanks for a great talk, Angela. As we've heard, developing drugs is a long progress, a long and expensive process, as well as diagnostic innovation. How will BIVDA help the adoption of those new novel innovations in the current financial climate?
It's a really good question. I think all we can do is advocate for our industry partners. So we can lobby Parliament to make sure that policies and legislation are in line with what works for our industry. We can make sure that, for example, the MHRA produce the right regulatory framework that helps our industry partners to bring their products to market in a safe way, but not in a way that's going to bankrupt them. We can work with NICE to ensure that the health technologies assessment that's there can work to ensure that the evidence is there, but also to make sure that that constant testing in the real world environment can take place quicker, so that adoption and spread can take place quicker. And we can do that because it's difficult for a single industry to do that individually. But when you have all the life science industry in the UK as your members, then you can advocate for a much bigger, you've got a lot more behind you. So we're able to go and speak with government with the whole of the life science industry behind us. We're able to work with MHRA with the whole of that industry behind us. And so we can make sure that any new policies, any white papers that come out, any legislation, we get consulted, and we can consult our members to make sure that it's going to be the right thing for them.
We'll take one more question from John, and then we will move on.
Angela, I sit on an oversight committee for the gallery trial with Grail on behalf of NHS England, as you probably know. And the interesting, although we can discuss whether it's a great project or not, the idea was that the NHS said, if this works, we will buy it. And I think it's a really interesting concept that we could potentially roll out with procurement in the NHS, you know, and basically has a sort of, you get a fast track, you know, we see you and we will guarantee to buy this much from you if you pass the following tests. We could then get past this horrible logjam where people reach the point of being saleable, but then there's this horrible gap while you're waiting and gradually running out of money and going out of bank. So is it possible to maybe engage NHS England with procurement to sort of pre-book some of the best ideas that could be overseen by BIVDA and others?
Around their framework. Right. Oh, sorry. That's one of the things that we're doing at the moment, speaking with NHS England around their frameworks, their procurement frameworks, because what we hear from our partners is it's very difficult to sell into the NHS unless you get it onto the procurement framework. So we're working with the supply chain to try and ensure that those products that have been through a real world evaluation in an NHS trust make it onto those frameworks, because once they're on the frameworks, they're very easy to procure.
If they could get promised of that, then it's a lot easier to get the money to stay alive, the investors, because they want, you know, businesses.
Absolutely.
Thanks very much.